GM, welcome to what's going to be another fantastic episode of DevNTell. So, if you didn't know, DevNTell is a 30-minute podcast held every week, allowing founders, hackers, and anyone in between the opportunity to come on the show and showcase what they built. And today, I'm ecstatic to welcome Caspar Barnes, who is the founder and CEO of AminoChain. So, if you didn't know, AminoChain is a community-owned infrastructure built to make research faster, more transparent, and more inclusive. So if you stick around for today's episode, you'll get to meet Casper, learn all about AminoChain, and the origin story around it. All right, let's do this. GM, welcome to the show, Casper. I'm excited to have you on today, man.
No, thank you for having me. I'm very excited to be here.
My pleasure. I know you are a busy man and are joining us from a conference live. So really appreciate you taking the time out of your day to do that. I guess, for the audience today, if they aren't familiar with yourself, would you just like to give a brief introduction?
Yeah, absolutely. Well, thank you for having me. Now I'm super excited to speak with you today, share a little bit more about who we are and what we're building. We are currently at ASHG, American Society of Human Genetics. So a big conference with all sorts of different people in the biobanking space and clinical genomics and research, human subjects research ethics and so on, community engagement, all the topics that are relevant to what we're building at AminoChain is like a good few hundred, if not thousand people here and so on. So that's the exciting thing we have in front of us. But yeah, so as a quick overview of who I am and what AminoChain is. My name is Casper. I'm the founder of the startup AminoChain, originally from Cape Town, South Africa. So I've got this funny accent. And I did my undergrad degree in the United Kingdom, studied economics and neuroscience, and moved over to the US around 4 years ago. I did a graduate degree in biotechnology and worked in cancer research for a while, and then did another graduate degree in bioethics at Harvard Medical School, and founded the AminoChain around 3 years ago. And initially, when we set out to build AminoChain, we were focusing on building a NFT marketplace of donated stem cells. And we were addressing the issue of not having enough allogeneic stem cell donations for people with blood cancer. And so for people that don't know, if you have leukemia, you have lymphoma, any type of hematological malignancy, like a blood type of disorder, one way in which you can get cured is through something called allogeneic stem cell transplantation. And that's where you go and you give a crazy amount of chemo and radiation to a patient that has blood cancer, and you kill all of their blood-forming stem cells. And then you take healthy stem cells from a donor and you put them into the patient, and it engrafts into their bone marrow, and then it reboots their immune system. And we need roughly 15,000 transplants every year for patients, and we're only achieving around 12,000. And that's through public registries of donors, that's through using umbilical cord stem cells, that's using haploidentical donors, so patients that are from, or donors that come from a sibling or parent, for example. Anyway, around 3,000 people don't find a match every year, and those patients unfortunately pass away. And the more we looked into it, it turns out that there's a huge economy for donated stem cells. So when people donate these stem cells, the nonprofits, the registries are actually selling the donated stem cells for $40,000 per allogeneic graft. And that means these nonprofits are turning over $500 million in yearly revenue selling other people's donated body parts. And that blew my mind. I say that makes no sense. How is there this huge economy for donated material that somebody gives out of the kindness of their heart? And the more we dug into it, it turns out that consent rates are particularly low amongst marginalized communities and patients of color. And so on the registry, if you're a white patient with blood cancer, you might have a 75% chance of finding a match. And if you're African American, you have around a 28% chance of finding a match. And if you're Hispanic or Pacific Islander, you're just shy of 50% likelihood of finding a match. And so it kind of opened up like this really interesting use case of there's an economy for donated body material, people giving this stuff for free and people selling it. And the people that are hit the hardest are the ones that don't have that trust in the system, typically marginalized communities or underrepresented populations. And so we decided to build a system to democratize this with crypto. We said, well, how about we just tokenize donated stem cell grafts, turn them into NFTs, list them on a decentralized marketplace, and then let researchers come and buy these NFTs, and when they buy them, we pay royalties back to the patients that donated them, and they can track where they go. And that was the first thing that we built. We thought, this distributed NFT marketplace is a good way to, bring back agency to research participants. And it was a phenomenal idea. I still love it. We submitted a prototype in a hackathon to get going. I met some great engineers. We put together our founding team, and that has now, through a crazy process of iteration, lots of speaking with biobanks and lots of, community health organizations and so on. It's evolved into a general, blockchain infrastructure to build healthcare applications. We are first focusing on connecting biorepositories of all types of donated body parts. And we're not working with NFT standard anymore. We have a different scalable architecture. But effectively, what started off as the idea of a marketplace for donated stem cells is now turning into a vision of building the Ethereum of healthcare.
Wow, that's amazing, man. And yeah, that's quite an undertaking. And I mean, for all the fuck that crypto gets for scams and rug pulls and all these things, seeing blockchain technology used for actual potentially life changing purposes is is phenomenal to see. And yeah, I read in a blog article of yours that you guys are actually partnering with Syndicate for your blockchain infrastructure. Did you want to just get into that a little bit and the purpose behind that?
Yeah, exactly. So as you can imagine, with something like what we're building, a general purpose blockchain for healthcare apps, there's a lot of real world hurdles that you have to overcome. Just like a basic example would be working with biorepositories or hospitals. If you want to sell them blockchain based software, describing the tech stack and the systems and getting the HIPAA accreditations and explaining effectively how the whole software works into a provider agreement or into a collaboration agreement or anything that a legal office of a hospital can review is incredibly complex. So the first time we tried this with lawyers, they just said, "Yep, everything's going to be visible on a public blockchain, and you take full responsibility of understanding how tokenomics work and what validated nodes are and so on." And obviously, the second we gave that to a hospital, they were like, "What the hell is this? There's no way we're signing those." And they were super confused. So we had to take a lot of time and effort and diligence into designing a really intricate protocol that bridges on-chain verifiability and trust, but also allows for scalable off-chain computation and flexibility in where PII and PHI is stored so that you actually achieve your regulatory standards. And after a lot of research and speaking with the phenomenal research team at ACCC Crypto, our investors and others, we've now landed on a sophisticated design that bridges an app chain infrastructure on Syndicate, where we can control information that's publicly visible. We can control, gas and token prices. We can basically sequence the transaction in a decentralized way and still leverage the trust of crypto, but have a lot more flexibility and and security in building trust that we need with the healthcare institutions. And so we're excited to partner with Syndicate on that.
Wow, that's amazing to hear. And yeah, there's always this weird friction with having this type of, I imagine, sensitive data held on chain, and a lot of people publicly available on chain, and a lot of people who aren't accustomed to that or accustomed to data living in a centralized location kind of have this, oh, what the heck, what do you mean? But I mean, I think data like this in particular, I think it makes sense to house on chain, and you guys seem to have crossed those hurdles at least at the beginning, to kind of get to somewhere that makes sense. And I guess going beyond stem cells that you mentioned as the initial version of AminoChain, what other kinds of scientific data are you guys planning on storing?
Yeah, absolutely. So we started off with stem cells that you mentioned, but it's important to note that there's a very distinct economy for different types of biomaterials. So like for the world of what we just call their allogeneic cell donations, which basically means stuff that comes out of a healthy person and into a sick person straight away. For example, blood blood donations, you donate, and then transfusions happen straight away. Stem cells, same thing, you donate them, and then they get transfused into a patient again. That is a very, specific value chain. You have a way to recruit people. You have things that are stored in a way. You have standards and making sure there's no infectious diseases, and then you get reimbursed medically by, including that as an item in the bill of the patient when they have the transfusion. So that whole universe is totally separate from the world of IVF, for example, sperm and egg donations, right? That is its own universe entirely, but it's similar in that body parts are stored and they're used for a procedure, and then they have an outcome. So the world of organ donation, and the world of stem cells, and the world of IVF, and the world of disease tissue, the world of population genomics, they are all totally separate. They have very, very different, flows and payers and users. And long story short, what we are focusing in right now is the world of what you call diseased tissue. So that means people that have some kind of disease, perhaps cancer or something else, and they donate a biopsy sample as part of a routine part of surgery for research purposes, not for clinical purposes. And of those types of biorepositories that store diseased tissue, we have roughly 2,500 in America. And across those 2,500, there's roughly 200 million samples stored. And across those 200 million available, we're only using around 10%. And the 90% of samples that are stored, ready for research use, are just sort of lying dormant and people can't find them. And even if you do find them, there's long processes of trying to acquire them. And so the first thing that we set out to build with AminoChain was basically a search engine for these existing biosamples. And that gave us a foot in the door and a relationship with all these big provider networks. And we've grown that out now to around a 30, biobank strong network across the United States and other areas of the world like Europe and Africa and so on. And across these 30 different biobanks, we have roughly 410,000 biosamples, and we have data on around 150,000 unique patients. So scientists can come and they can search across this distributed database of stored diseased tissue that they want to use for research. And they can request that directly, and then they can get shipped, and then we increase the visibility of existing biosamples. Now, that's got nothing to do with crypto just yet. It's just a totally centralized solution. But we've got a great foot in the door with all these big hospitals now. And the next thing that we want to build is the same users that are interacting on the search engine where they go and request the samples. We now want to flip the switch and actually make them interact with digital assets on a chain, or with something on a digital record, right? Something that has a blockchain backend. And in doing that, we then, unlock a whole world of new user experiences for these scientists. They could, return information, or they could, query unknown, clinical data on a de-identified research participant, or they could build a clinical recruitment registry, or they could do all sorts of things in a decentralized way because the infrastructure provides it in the backend. So, long answer to your question, but basically we're focusing on all sorts of disease tissue.
Yeah, that's wonderful to hear that so much data is now available for scientists and researchers to use. I guess having this much data available, is there any scientific breakthroughs or anything like that that have come from this data being available that you can share, or maybe in the works?
Not not yet, unfortunately. So the platform was launched maybe like 5-6 months ago now. But the network has gone quite strong. We have recently signed with some very large academic medical centers in the United States. Some, I think I can share them. Yeah, so we signed with providers at Northwestern, for example, and some at Scripps, and some at McGill University, and a number of others. And basically now all these scientists can go and log on and look through the inventories and distribute their samples. But what exactly they're using them for, we're not tracking this yet. So that would be another step as well.
Gotcha. But I mean, the ball is rolling, so scientists are going to get to work, right? When they have that data available to them. Uh, And I guess this is a good kind of segue if you wanted to kind of share the platform itself, just kind of take us on a mini tour of what AminoChain looks like, the platform.
Yeah, no, I'd be happy to. If we could pull this up. So this is, you can see my screen?
Yeah, you're good. Sorry, I was on mute. Yeah, you're good.
Amazing. Great. So this is the Specimen Center. This is totally live. Anybody that wants to can go and log on and check all this stuff out. And if you go to app.aminochain.io, this is what you see. A whole network of biorepositories that we've integrated. And you can click on the profile page of the biobank. You can see the high-level overview of the collections they have, their contact information, so totally transparent. And this is effectively like Facebook for biobanks. People can go and create their profile pages. You can see the overview of their collections. And for some of them, we've integrated into their inventory management systems. So we're pulling live updates about how they use their samples, what they have stored, what's available. And others, they send us a inventory list on a regular cadence, like once a week. And then we take all that information and we update it here on the Specimen Center. And now this is what the view looks like for filtering across all those collections. So of those 30 different banks that we have on there, here you can see the filters that we're able to search by. You can search by diagnostics, by specimen type, by donor information, or so on. Or the most recent thing that we've just launched is natural language processing. So you could try to search for something as a normal string. You could say, let's see, we want breast cancer samples from women under 30 in the USA. And then this beautiful thing called AI will ingest the query and will attach the relevant filters that apply to what we were looking for. And then it will return all of the results of the available samples across the whole network of 30 biobanks. And here we go. You can see there's around 125 specimens that fit our need. And we can filter through all of them. Here we can see pathology information, preservation details. And this is all de-identified, right? So these samples aren't necessarily linked back to the patient, but if we wanted to, we could add them to an inquiry and then we could request the specimen directly from the biobank. So we can put information here saying, you know, did this patient have a BRCA1 mutation or whatever you want? And this is live, so if I send an inquiry, then that would actually go to the bank, so I'm not going to do that. But this is what the flow looks like at the moment. And this has got nothing to do with blockchain. What we're excited to do now in the next few months is actually launch this as a protocol integrated product, which means that this 29-year-old woman, even though we don't know who she is, she could have a patient interface and she could track how her samples and data are being used. And when I buy this specimen here on the marketplace, I can pay royalties back to her. So she can earn dividends from the use of the specimen. And because there's a connection back to her, we could query any survey information she fills out or any clinical data that she has on herself without knowing who she is. So we could query that through clinical record, through zero knowledge proofs, or other encrypted systems that we have in the backend. And that is effectively where the blockchain comes in. And this is where we are right now.
Amazing guy. It looks like you've built quite a bit in just a few months there. I'll bring your screen off. Yeah, I guess is there since we are a developer-oriented show, are there any plans to expose this data via an API or something like that in the future? Any use cases you guys have thought around that?
Yes, absolutely. Like, I mean, the people want retrospective samples, right? Like they want what I just showed there, but people don't buy samples to look at them because they're beautiful and they want to hang them on their fridge. They want to, turn them into data sets, right? And so that's where the real value is. And that's what we're here discussing at this conference, right? Like, I mean, people want not just genomic information, but they want proteomics, metabolomics, and transcriptomics, and so on. So we need all layers of what's happening in your molecular biology and in your genetic biology. And so that is what people really want. So that's what we're moving into now. Like, instead of just looking through existing biospecimen collections, we will actually start to aggregate multi-omic data sets on the same people, and then still have this economy where they can like earn incentives and they're actually sharing in the benefits that their donations derive. And when all of that data is aggregated into the system, theoretically, yes, if it's a decentralized protocol, anybody should be able to source that data and build a target discovery platform or use it in a way that's decentralized. And we would just be the permissionless infrastructure layer to let people do that. That is, of course, our ambition. Like, practically, what does that look like in a stepwise action is a question that I guess we're still answering. Because once you have the data sourced, do you have one dedicated trusted research environment? Do you let people download the data and then it's gone and you lose the provenance of it? Or do you let anybody integrate their own trusted research environment at the front to like surface the data? There's still a number of things that we need to consider in there. But the vision and the ambition, of course, is to be as decentralized as possible, which means it would be akin to something like an API. People can sort the data or do their own pipelines or discoveries or whatever on the stuff that's in the decentralized biobank.
Yeah, and definitely, yeah, it sounds like there is quite a bit to kind of still shuffle through, but it looks like you've built, or you guys have built quite the foundation already. So it's going to be exciting to see how it kind of evolves from here. And is any of this open source by chance? If there are some people here who are interested in helping continue to build out this vision for them to contribute, or I guess, are you guys hiring if anybody is interested in throwing the hat in here?
Yeah, absolutely. No, I mean, we're certainly hiring. Absolutely hiring. We are, deep in protocol development. Designed something that will be progressively more and more decentralized. And eventually we'll get to a point where, yeah, it'll be open source. People can build on it. At least that's our ambition, right? And, in the meantime, unfortunately, the software on the back end isn't open source, but the interface is, and the system. So anyone can go and use the data or the application. And we are always on the lookout for top talent that wants to come help and join our mission in building trust in science and healthcare. So please do reach out if you think that's you.
And I guess on that point, if people do want to reach out, what's the best way for them to get in contact with you?
Absolutely. Our website is the best, www.aminochain.io. We are also active on X and LinkedIn and newly Instagram. We just redid our Instagram page. It needs some love. So anybody that's active on Instagram, please go give us a follow there. Again, just add AminoChain. And yeah, so through the website, through our socials, please just reach out. Like, that'll go directly to us and our team.
Amazing. And I got a couple more questions here before we let you go. Just wanted to ask you, in terms of the roadmap for AminoChain, is there anything that you kind of like to share or kind of tease out for what's upcoming, perhaps early 2026 or maybe even this quarter?
Yeah, absolutely. So the next thing that's on our agenda here, right, is like, all the things that I just showed you don't actually have a connection back to the human being that donated them, right? And now we're actually starting to focus on the stuff that we came here to do, which is, bridging equity and agency back to the research participants. And so we're so freaking excited to roll this out. But people will basically, in partnership with 2 different, perhaps even 3 different sites and biobanks that we're speaking with at the moment, we will have kitting infrastructure set up, and we will send these little kits to people's homes. There'll be a small capillary blood collection device in it. People can collect blood, put that in the box, and send that back to the biobank. Oh, sorry. When the kit arrives, they have an app on their phone, the donor portal that they download, and they scan the kit ID with their app. There's a cryptographic handshake happens there between the kit and the donor portal. They send the kit back to the lab. They bank the blood. They generate data sets, populate it in this beautiful biobank, and then we're live. Anybody that comes and buys that stuff, the patients earn points, and this pointing system they can then exchange for a suite of different incentives, for Uber credits or for flight miles or for whatever else that they want to exchange it for. And we're testing out the whole incentive system, the whole kitting architecture, the aggregating samples and omics. And the two main indications that we're focusing on now will be psoriasis and myasthenia gravis. And that's on the roadmap now. We're recruiting for those actively, so I should have actually mentioned that as well. If you know somebody that's suffering from one of those two conditions, and hopefully we can be of service to you and get you more agency in the research process.
Beautiful. Yeah, there you go. If you're someone watching today, and that kind of fits your is a fit for you, definitely reach out to Casper. And just to end things off, kind of on a general note, I just was curious to kind of get your thoughts on the DeSci space in general, and where you think it's at, and where you think it's going to be heading in, say, like 5 years time, 10 years time.
Yeah. In other words, when token, right? Is
Not quite. Not quite. It's
no, that was joking.
just in terms of like we know there's like a lack of hardware and whatnot for a lot of people that want to run big model sets through ML processes and whatnot. And yeah, I guess how do you see kind of this lack of resources or innovation in
Mm.
the space kind of evolving over time?
Yeah, it's a really great question. Sorry, I was being a bit facetious there. It was just like jokey, but like a lot of the DeSci narrative today is like inextricably linked with whatever crypto asset people are trying to launch, like against the projects. And so I think if you're an early developer in any crypto-enabled product, if you launch a token before you have product market fit, then you seriously risk losing credibility in what you're building. And so you need to design what you're doing carefully and get users and already set up as much as you can, even using stablecoins if you have to, but then move into a bit more of a token guided network effect or whatever. So what does that mean in healthcare? Because that's like a 10 times harder problem, right? Especially if you're trying to service institutional healthcare or enterprise healthcare customers. It's a messy situation to be in. So our ambition with AminoChain is to be that composable layer that has the relationships with all these big academic medical providers and big pharma companies, so that others can go and build dApps on it, that there's automated compliance, and that there's trusted infrastructure to everyone. Let's say, for example, they wanted to build a DPIN network for contributing healthcare data towards ML, like you just said, or if people wanted to, I don't know, build a system for tracking your medical records with you between providers that you go to, whatever. Like, you would need the different providers to all be linked to the same blockchain infrastructure. So anyway, we want to provide a platform for developers to be able to build that, right? That's our goal. And I think DeSci in general right now is suffering from a little bit too much of a like crypto first narrative as opposed to a innovation first narrative. Aside from like the hardware things that you mentioned, I think people in general are too like entrenched in trying to do everything in a hardcore decentralized way from the ground up, and not many builders have like tried to approach this with like a prudent mindset about progressive decentralism. And like, how do you compromise on needing to be a central authority for trust a little bit in the short term so that you at least gain trust, and then you can make a permissionless trust and so on. It's like there's a serious art to building a company in general, but then trying to build a crypto company for healthcare institutions is like really freaking difficult. So where do I see the DeSci ecosystem in general? I have the same vision as everybody else. I totally believe that we'll get there at some point. You ask me in 100 years time, would all medical records be centralized? Would there be no way to track my data from one place to the next? Would I have zero incentives in all the research data being used for research? But like, no, obviously those problems will get fixed. They have to get fixed, right? So in 100 years, I think we will address them. I think there'll be many attempts of people trying to fix it and not being successful in the meantime because they approach it in the wrong way. And I think that's ultimately where we're trying to be very careful and very deliberate. And hopefully, if we do it right, then it will be a win for everybody, because we could just hand over the keys to developers and let them build to their heart's content.
Great answer, and great great thing to kind of leave our viewers with, to stew on a little bit over the weekend. Casper, thank you so much for taking the time out of your busy schedule to come chat with us today. It was a pleasure having you on, and yeah, really looking forward to seeing how AminoChain evolves as the months and years kind of go by here.
Thank you so much, Nav. Had a lot of fun. I really enjoyed it.
E- Excellent. So did I. So did I. All right, all. With that, just want to wish everybody a very happy Friday, happy weekend wherever you may be, and we'll catch you back here for another great episode of DevNTell next week. Till then, have a good one, folks. Bye.